Hi everybody, Dr. Sult here with aesthetics. It's, I don't know, a little before 6 a.m. probably, and we're out walking the dogs. And I wanted to respond to another question I get, and that is, how do you know when you need a tummy tuck versus just plain old liposuction? And it depends a lot on your goals and what you're trying to accomplish, but the bottom line is how healthy your skin is, on some degree, how many stretch marks you have and how old you are. So the younger we are, the better we are at making collagen and all of these proteins in the skin. I think of these proteins kind of like slinkies. A slinky is really stretchy until you stretch it too far, right? And then once you stretch it too far, it won't go back. If your slinkies have been overstretched, your skin's not going to recoil. So we make less collagen when we're older, and we make more collagen when we're younger. And if you have a lot of stretch marks, you have a lot more damage and probably less recoil. The other way to think about it is if you have subcutaneous fat, fat just underneath the skin, and your skin is pulled tight over it, so it's fairly firm, you're more likely to have skin recoil. And if it's not firm, you're less likely to have skin recoil after liposuction. So then, if you think about the volume of fat that you have, and you think about deflating that with liposuction, and you think about the amount of skin, so think about a balloon, it's inflated and it's stretched out tight, and then you deflate the balloon and it's all loose and wrinkly, right? Well, if you think about that loose skin retracting about 50%, so you kind of look in a mirror and you grab the area that you're worried about, and you just sort of think about the volume and think about it being deflated and think about it being just skin, and then think about it retracting about 50%. Now, if that's an acceptable result to you, then you only need liposuction. And for many people, they will control the loose skin with, an undergarment like Spanx or something like that. And they're perfectly happy with just the reduced volume and the less, better profile, if you will. Some people, though, they want tight skin. They want all that excess skin gone. And for those people, a surgical removal of the skin is going to be necessary. We're going to need to, do a tummy tuck, or, a leg lift or an arm lift or whatever it is that needs to be lifted. So that's sort of the reasoning behind liposuction versus tummy tuck. And I'll tell you that most people are really interested in, that wow result, right? So a lot of people think, yeah, I'm going to be perfectly happy with liposuction alone. And so we do that. And then they come back and they say, it's just not really quite what I wanted. I really wanted that skin gone. So it's a hard decision. It's tough. There's nobody that can make that decision for you. You really need to stand in front of a mirror and hold onto that skin and hold on to that fat lump you have and think about what it means and, work it out. You need to think about it. If you don't think about it, and if you don't put some energy into understanding what your goal is and what you're after, you're not going to have the outcome you're interested in. So there's the ideas on how to work it out.